All right, today we are tackling a really important topic, one that affects millions of people all over the world. And honestly, it's on the rise. Lung cancer. You hear it called a silent threat all the time. And in this explainer, we're going to break down exactly why that is, and more importantly, what we can all do about it. So let's just jump right in and see how serious the situation really is.
Okay, to get a sense of the urgency here, just look at this. In a place like Taiwan, lung cancer is now the #2 cause of cancer death for men, and for women, it's #1. That's not just a statistic on a chart, that's a huge health alert that shows you just how widespread and, frankly, how indiscriminate this disease has become.
So what is it that makes lung cancer so incredibly dangerous? Well, it's not just the disease itself, it's how stealthy it is. You see, by the time most people finally get a diagnosis, the cancer is often in its advanced stages. And that makes the outlook pretty grim. This is exactly why knowing the risks and recognizing those super early signs is a total game changer.
Which brings us to our first big question. Who are the real culprits here? Let's start pulling back the curtain on the risk factors. We'll start with the one everybody knows, and then we'll get into some that might actually surprise you.
Yup, no surprises with this one. The undisputed #1 cause of lung cancer is smoking. It's the one we're all most familiar with, and for a very, very good reason. The link isn't just a theory, it's direct and it is powerful. And when I say powerful, I mean the scale of the risk is just staggering. Smokers aren't just a little more likely to get lung cancer, they are 10 to 13 times more likely. And listen, that risk doesn't just stop with the person holding the cigarette. Being around secondhand smoke consistently can dramatically jack up the danger for everyone around them too. But here's where things get a little more complicated. It's a huge mistake to think you're in the clear just because you don't smoke. Turns out there are culprits hiding in plain sight. Things like everyday air pollution, the fumes from high-temp cooking in your kitchen, hazards at your job, and even things like a high-fat diet or having had lung issues in the past. And you might be asking, how hidden can these dangers really be? Well, get this. Some really common building materials, like granite, can actually give off radon, which is a colorless, odorless gas that we know causes cancer. It's a pretty stark reminder that the risks can literally be in the air we breathe at home or at work.
So with all these different risks out there, how in the world can we know if something's wrong? Okay, let's shift gears now and focus on our own bodies. We're going to try and decode some of those subtle and often really confusing warning signs that our lungs might be trying to send us.
So here it is, the million-dollar question. If you had an early-stage lung tumor, would you even know it was there? For most people, the unfortunate answer is probably not. The very first symptoms are notoriously vague and just so easy to brush off as something else.
Let's take a hoarse voice, for instance. We've all had one, right? Is it just a cold? Most of the time, yes. But what if that hoarseness just doesn't go away? Or it gets worse, maybe even to the point where you lose your voice entirely? That could be a warning. You see, the difference between a common bug and a potential red flag is often just one simple thing: persistence.
So what should you be on the lookout for? Basically, anything that's new and just refuses to quit. That persistent, nagging dry cough is a classic one. You should also pay attention to chest pain or pressure that keeps coming back, or feeling out of breath way more easily than you used to. And some of the biggest alarms are things like coughing up even a tiny trace of blood, or fighting off these weird, unexplained fevers that just keep returning. Any of these things really demand your attention.
And to make it even trickier, the symptoms aren't always in your chest. The disease can cause issues all over your body. Things like losing weight without trying, feeling deeply tired all the time, or having achy joints. This is a huge reason why so many patients get checked for things like arthritis first, which of course delays the right diagnosis.
Okay, we've gone through the risks and the warning signs, and I know that can feel pretty heavy. But knowledge is kind of useless without action, right? So now let's get to the most important part: what you can actually do to start building a shield to protect your lungs.
The good news is you absolutely can lower your risk. Step 1 is the biggest and most powerful one. If you smoke, quit, and avoid secondhand smoke like the plague. But your indoor air is also super important. Simple things like opening a window when you cook or making sure your kitchen exhaust fan is clean can make a huge difference. And hey, if you live somewhere with a lot of pollution, an air purifier isn't a luxury, it's a key part of your defense.
You can also build up your defenses from the inside out by literally eating them. Think of foods that are packed with carotenoids. Those are your lungs' best friends. So load up on deep green veggies like broccoli and spinach, and all those vibrant oranges and yellows like carrots and tomatoes. And if you throw in other power foods like walnuts and green tea, you're giving your lungs an extra layer of protection.
Now, beyond prevention, we have detection. The most basic tool we have is a simple chest X-ray. It's fast, it's not expensive, and it's a fantastic first step to just get a baseline picture of what's going on in your lungs. And for anyone in a high-risk group, getting screened regularly is an absolute must.
So, if we could leave you with just one single message today, this would be it. Please, listen to your body. Don't ignore a symptom because you think it's nothing. If something feels off and it's not going away, go see a doctor. When it comes to lung cancer, catching it early isn't just important, it's everything.
And that pretty much wraps us up. We'll just leave you with this final thought to chew on. You know, we think about our heart health, we think about our weight, but how often do we stop and really think about our lungs? After all of this, the simple question is, what have you done for them today?